that is a curriculum that is actually aimed towards potentially immigrating to other countries, let's say UK or the US or Canada or Australia, other English speaking countries. So for me, it started actually right before I even actually did the residency. I was in Brazil. For those that are Brazilians in this call, they pretty much know the reality there. I did not have the financial means to come to the United States right after finishing medical school for multiple reasons and family reasons, I should say. So because of that, even though I did an exchange program during medical school, I went to Canada and I stayed for 3 months in British Columbia in Vancouver. I went back to Brazil and I saw the reality at University of British Columbia, UBC, and I saw the reality there. I went and visited the campus because I was a medical student, and everything looked actually, wonderful, right? Everything's nice, and for all the matters, the Canadians are very nice, very hospitable people. They're very, especially in the west part of everything here in the North America, everything west is kind of a little bit calmer than the East, I should say, because I trained in New York, so I can say that. And now I work actually in the West in Denver. So for me, it's actually, I've had this experience pretty much actually all the regions in this country. So I didn't have the opportunity. So I had to do, a residency, general surgery residency, vascular surgery residency in Brazil. And that dream, I stayed there, in the back of my mind, but, I could not exercise that. So I have to work, right? I have to go to work and I have to be trained and do what I have to do. So towards the end of my training in Brazil, I start seeing the difficulties that we have in Brazil, right? Difficulties with like materials, difficulty with like, I would say like, climbing up the ladder. When in Brazil, unfortunately, there is a lot of like, situations that don't allow us to climb the ladder as fast, okay? So what happens in Brazil, sometimes you want to do academics, some of the academicians or the professors, they are what they would be like similar to say here, they're tenured faculties, and they stay there forever, right? Sometimes they stay there when they are 80 years old, 85 years old, they cannot barely operate, but they are still holding the title. They're still holding the title to be, the chief of something, right? So, and then you have a lot of young people trying to climb the ladder and actually fighting themselves in order to produce, and some brilliant people that are kind of like, in the shadows for like 10, 20 years or so until they get the opportunity. Some of them never get the opportunity. Okay, so that's very frustrating, because you see people that have the passion and they have actually skills to do something, but they unfortunately are blocked from advancing fast. Okay, and in Brazil and other countries too, there are several like political conditions, like relationships. So in Brazil, there's a lot of like I saw nepotism a lot in Brazil, especially in surgery, right? My grandfather was a surgeon and he dominated the picture here. And then my father is a surgeon. And then I am a surgeon. So I am in the same actually path and the same actually, pathway to become the chief or something. So those things have changed lately in the last 2 decades since I left medical school. But there's some things that actually bother me a lot, because, it's not because of anybody in my family, it's because of me. It's because what I can offer, because of my skills and everything else. So that's one of the things that actually made me come to the United States, to get more education, everything else, right? Another thing is the opportunity to have more of a decent life without actually violence. So violence actually played a huge role for me. I grew up in a town in Brazil that's very close. Now it's almost a suburb because it's very close to São Paulo city, which is actually millions of people actually living there. I don't know how many now, 12, 14 million people living there in city. And every time you're in São Paulo, I always avoided to actually to go to São Paulo or to do residency in São Paulo. If I had the opportunity to be trained somewhere else, in my state, my home state, and I had the opportunity to be trained in big institutions in São Paulo city, I prefer to go someplace else. I'm not the type of person that like to have like, to be robbed at gunpoint. And, as many in Brazil, I have been robbed at gunpoint twice in Brazil and have like my car stolen and the whole 9 yards. Some people say like, that's okay, that's fine. I mean, it's life. I'm going to leave it here. For me, life was much more than that. You know what I mean? And some people don't have the opportunity to actually move and everything else, but the opportunity, you create the opportunity. That's how I see things, right? You have to train yourself. You have to be prepared when the opportunity comes. So violence was one thing. Another thing was actually the pathway, the growth pathway in academics, especially academics. I'm not talking about private practice. I'm talking about academics. And also to have an opportunity not to have to actually drive like for like, here in private, you might do that even in academics, but to be crazy, like, going from one side of the city to another side of the city to another side of the city, which is a very common reality in Brazil. Some people don't have to do that, but there's a lot of people that, be on call here, on call there and everything else. I wanted something more stable that I could actually focus. And the last one is actually opportunity to do research, which is in Brazil, it's very limited, the amount of dollars that we have to do research. And it's very hard to sometimes coordinate that. So 4 things, right? Violence research, job conditions, basically, and academic opportunity to grow.
Thank you so much for answering this question in such a detail. And while you were answering it, I realized how similar Brazil and Pakistan are in many all the things that you mentioned, actually, because these a few of these reasons are why so many people want to move to United States or maybe even the UK to find better opportunities. And also your story, it's so inspiring, because a lot of my peers and even my seniors in Pakistan tell me how difficult it is to get a surgery residency in the US. So it's better to choose internal medicine and not opt for it. But I mean, you give me hope. So thank you. Gabriel, would you like to ask the next question?
Sure. So Dr. Malgor, we as international medical graduates, is it true that we face many challenges in the matching process? For example, the university qualifications, the amount of paperwork, traveling abroad, doing the interviews, and also even to travel to take the steps, English barriers, and so on. So I wanted to ask, what were the challenge that you faced during matching, during the match and during all this process?
I think the biggest issue is that nobody knows who you are. Okay, so you are one of the thousands of candidates that they have to review, right? And I think the biggest challenge is like how I'm going to be the one. Let's imagine a box with a bunch of folders, right? How I'm going to be the one that they're going to actually, look at that box and they're going to reach to the box and they're going to pull the folder, and I am the folder and I'm the one that are going to be interviewed. So how I'm going to get an interview? I think that's the question here. The question here is like, how's the challenge? How I'm going to get an interview, right? So it's so like hard to summarize this in a few minutes only, but I can tell you that it is a combination of factors. It is a combination of factors. For instance, we Brazilians, we have a group that's called USMLE Brazil. That's probably the USMLE Pakistan. There's USMLE, Peru. Everybody has a group like, in social media, everybody help each other. And then the SP solvers is one, it's a one tool, right? It's one strategy to get there. And I applaud you for this, because that's how the word gets around and people know what's going on inside of the United States. And it's always, I tell, and I have several mentees, but I always tell them that you have to know the difficulties to get here, okay? And the biggest challenge to get here, the first biggest challenge to get here is language. When you actually get to the interview, right? If you are not really like trained to do the interviews, it's going to be hard for you. And if you get an interview, you're going to show up there and then they're going to start to ask questions. You're going to be like, mechanical. You're not going to be able to actually answer the question. You're going to freeze. You're going to freeze and you'll be frozen there. And then you're not going to be able to answer those questions. So I think language barrier is one of the things that actually count there, right? For the interviews. And other things is like, how are you gonna, some people have the means to come to the United States and say, oh, I'm gonna pay to stay in this hotel, in this house, Airbnb, or whatever it is, and I'm gonna apply and everything else. And there's some calculations in the internet that you can see. Those are thousands of dollars that you have actually to invest in this opportunity. And sometimes you don't get an interview. That's it. You just don't get an interview, right? Or sometimes you're just sitting there for like a year or two until you get an interview, or you can actually match in certain program. So I think the biggest challenge here is that you have to understand the combination of factors, and you have to work in each potential piece of that. Nowadays, we is passing to the score to pass and fail. That's pass or fail, I should say, pass or fail. So that's something that is important to say. So scores are going away. That actually, it's on its own. It's in and of itself. It's an entire session that we could interview here in terms of no scores and holistic actually review interviews and everything else. Okay, you can actually have like 10 sessions of SP solvers just to solve one question that you want to answer, like, no scores versus scores and so forth. So I think the biggest challenge is it's language when you get to the interview. And before the interview, I think the biggest challenge is to make sure that you have all credentials, in line, like, good scores or great scores, I should say, great scores, a great experience. Like we talk about, like, nowadays, in understanding the system. For instance, this is not much, actually, it's not much of a secret, but here in our institution, one of my partners is the program director for general surgery. He's a vascular surgeon that's a program director for general surgery. And even actually, he said, like, do you want me to participate on this and everything else? Like, no, you're very busy. I can actually transmit what you tell me. So I talked to the program director for general surgery here, which is the second largest general surgery residency in the United States. It's in the University of Colorado. We match like a 12 actually categorical residents. It's huge for the United States here. So I always talk to him and everything else, because we move into a more holistic interview process now. Our institution got 600 applications. That's actually after refining for score, let's say 230 cutoff for step one. 600 applicants actually make that, but you say, like, no way, there is more than that, right? There are more candidates applying, but they decided to focus on the American graduates this year. So there are only very few international medical graduates that were selected to the interview. And you're going to say, like, why is that, right? There's several actually, there's several steps that, that the residency goes through to decide to do such a thing. And the people say, like, oh, so you're not IMG friendly and everything else. That's not true. I would say that could be something that you can face as a barrier, but once a foreigner actually is inside of our residency and everything else, the treatment is the same. So what I'm saying is that the selection nowadays became very difficult for us, because it's Zoom. It's not Zoom, I'm sorry, it's Thalamus that we call. It's like, it's virtual interviews. So everybody actually applies to almost every single program, because they don't have to travel. They don't have to come here. They just sit there and actually do the interview. So the cost for the American grads too decreased a lot. So that doesn't help the international medical graduates, because we got flooded by a bunch of applications, and we have to decide what to do. I know University of Pennsylvania started the holistic review as well. They didn't, I think, included for at least for preliminary for the general surgery, and they had more than 1,000 applications. Let me tell you one thing. Even having like a faculty like with 85 or plus like 100 surgeons or more that we have here, right? We are a huge place. Even having a faculty that big, it's hard to review all the applications because you can't expect only the program director, associate program directors to review 1,000 applications. They are surgeons. They operate, they take care of patients, and they review applications. So when people say like, the program coordinators run the programs, it's not that they run the programs, but their portion in terms of filtering the applications exist. And you have to know how you're going to be, not to be filtered out from the program coordinator, and you're going to get to the program director or the associate program director. So the biggest actually challenge is language for sure when it comes to interviews, I think, and culture too. But then you should have like a very holistic application. Do not think only scores are going to get you there. You need to have community actually services. You have to have research and everything else. And we can talk more about it in the next question.
Thank you so much, Dr. Malgor, for sharing your experience. And I think it's a very important talk because the resources that we have as international medical graduates picture all these experiences as magical and beautiful, but we have to be aware of the reality, as you said. Rafa, why don't you go next?
Okay, so Dr. Rafael, we were thinking about, since you were already an established surgeon in Brazil, if you could talk a little bit about the advantages and disadvantages to practice surgery in the USA compared to your home country.
Great. And just let me tell you something. Those are my own opinions for this. I'm not representing the university. Those are my own opinions that, in my practice here as program director, associate program director, that's nothing. This is not an official University of Colorado actually session. So what are the advantages of practicing? Let's talk about the disadvantages first, right? Because everybody says, well, the United States is actually always, it's golden, right? It's perfect. It is not perfect, okay? So if you think that you come to the United States and all your problems are gonna go away and you're gonna live in heaven, or the type of heaven that you think, or the best thing in life, that's not true. You gotta put your feet on the ground and know the reality here. So the disadvantages of actually being a surgeon in the United States, the first one is medical legal, right? The medical legal system here in the United States potentially is as bad as the other places, but for sure it's not as bad as in Brazil, especially because in the United States, there's no socialized medicine, right? There is single payer medicine. That is actually the VA, for instance, the Veterans Affairs is a single payer because it's a federally ran institution, right? But or the Indian Health Service that we have too for the Native Americans, they are potentially considered a single payer system. But most of the systems here in the United States, they are not single payer. They are funded by private enterprises like insurance companies and so forth. So there is the medical legal system in the United States that everybody says like, oh, if people get sued there, it's millions of dollars and this and that, the whole 9 yards. So the medical legal system in the United States can be a little bit frustrating in terms of like, not the freedom. I think the patients should have the freedom to actually look for their rights, but because some people, because of the exploitation of the system by some, not for by all, but by a few actually in the legal system, lawyers and everything else that try to pursue actually litigation or claims or like lawsuits by all costs, and that's why we have the designation that sometimes you say like the lawyers that are ambulance actually chasers, right? That means that they are always looking to sue somebody for the money, not for the rights or anything like that. But I'd rather believe this is a minority, but gets exploded because sometimes the lawsuits can definitely actually return millions of dollars, like $1-2 million or so, if there is indeed actually harm and everything else that they can prove, right? So medical legal system is not something that leaves us with like, that peace of mind. We always like, trying to do the right thing for the patient. And if you do what's the right thing for the patient, even if you have somebody going after you, you're probably going to dismiss that because you did the right thing for the patient in the standard of care. So that's one thing. But in reality, it puts a lot of pressure in the system, it puts a lot of pressure on us and so forth. So that's potentially a disadvantage because of the field that actually exploit the opportunity of the medical legal system. Another thing that I would say in the United States, for training purposes, some of the disadvantages is that some places in the United States, because of this medical legal because situation, has less autonomy for the residents. Okay, so there is a lot of nervousness and pressure, and sometimes the attendees tend to actually take on the case and leave the residents without doing the case for a prolonged period of time. But don't get me wrong, this happens in Brazil too, when people actually, the professor comes and does the procedure and the residents are just actually holding retractor. So this actually happens there. So it's a little disadvantage there in this case, right? I think the paperwork and the bureaucracy sometimes in the United States, the medical records in Brazil in the United States is completely digital. And because, again, a little bit of medical legal too, we have to document it heavily. So sometimes I spend more time in front of the computer charting and actually doing medical records than the time that I wanted to actually dedicate it to my patient only. So medical records are heavy in the United States because we have to document every single thing, which is the right thing, but it's also cannot mitigate burnout. So the burnout here can be real too. In Brazil as well, but I believe that here exists as well. What are the advantages of practicing in the United States? For sure, advantage is the abundance of resources that we have, right? Even if you are in a small town in a rural area, you're probably going to have access to endovascular materials like in vascular surgery. You're going to actually have access to staplers, right? Like to do bioanastomosis and everything else. And in Brazil, when I was practicing in Brazil, there is some catheters, balloon catheters that we use to declot, to take the clot out of the arteries and everything. That's called Fogarty catheters. And those Fogarty catheters, the balloon is very fragile. Sometimes if we burst one balloon, you need another catheter when you pass through the vessel or something. And I remember when I was trained, now apparently it got better, but we could not use more than one balloon because the socialized system only paid for one balloon. So you always was nervous about asking for the second, third balloon, because then the administration would come after you and say you use too many balloons and we shouldn't do that. But you say but I saved the leg, but you used too many balloons. So here in the United States, you have to be conscientious about it. But if I need 2, 3, 4 balloons to save somebody's leg, the balloon is going to come. You know what I'm saying? So the abundance of resources that we have here in comparison to Brazil, it's huge. The less technology access, less technology approved by the FDA. So it's not that I'm going to have all technologies that are actually from outside of the United States, but at the same time, we have most of the technology that we have here, but it takes a little bit of time. It's like the FDA says looks around and say, let's actually this be proved by trial by fire in other countries before it comes to the United States. If this is actually good or bad, it can be good because you can say if something has a problem and it's not going to make, don't come here because I don't want something that's going to fail on our patients. That's one actually take on that. The bad take on that is if something works very well outside and I need to have it here, I'm probably not going to have it here. So then becomes a disadvantage. Then the FDA actually works against us because we wanted the technology that been working very well and saving lives outside of the United States. So it's advantage and disadvantage. But the biggest advantage that I see here, it's for a person like me. People say you shouldn't use these strong words and everything else, but I'm very transparent. I'm very I don't really sugarcoat. But and people say in Brazil, my father was an engineer, my mother was a mathematician. So basically, I'm a nobody. Okay, I'm a nobody that actually trained in Brazil. I don't have anybody actually to support me. I don't have family. I don't have a lot of people actually behind me, giving me the best opportunities that are very limited in Brazil, right? But when I came to the United States, I could actually, it's meritocracy, right? So I could actually prove my merit here and I could see the opportunity to grow fast. So the opportunity in the United States that you have, if you work hard, you can grow fast. In Brazil, you can have this, but it's more limited. So that's an advantage of having in the system, being in the system, financially, I should say, and academically as well, to actually grow fast, instead of waiting like 5-10 years to get into a group and so forth.
Well, thank you so much for your answer, Dr. Rafael. I think sometimes we have this dream of going to the US, and sometimes we don't think about like the struggles along the way and what we should expect once we go there. So thank you. Maybe you can go next, Daniel.
Yeah, sure. So just hearing your story, Dr. Rafael, you talk about your pathway and your story, and I think there is no better person to give an insight about any obstacles that you may have faced being an IMG and also a resident in the US. So were there any, and what were the biggest obstacles that you faced being an IMG?
I think the biggest obstacle that I face is the culture shock, right? I think the culture shock is it's noticeable when you come from a country like Brazil. In Brazil, and you're probably going to ask me this question later, but in Brazil we have like the relationship we have with our patients. Some of our patients actually, a hug. Some of our patients even actually do some things like kiss in the face and do all sorts of other things. It's very passionate, right? One of the first things that happened here when I came to the US is like, you got to actually talk with your hands less, okay? Because talking with your hands here in the United States is mostly not something that's well perceived. Nowadays, with more liberal minds in the last, decade or so, I see that people are more receptive to it. But, for the old school people, like, other generations and everything else, in other places that I work, that really actually is negative impact, because like say for me, I'm half Hispanic. My dad actually is a Bolivian, and I'm half Italian as well. So for me, actually speaking with my hands is like something that's, part of my culture, right? But when I came here, it became something like, he might be nervous or he's anxious or he doesn't know what he's talking about because he's really like being very, gesture driven there. So I think the culture shock was one of the things that actually happened to me. And I was always like, super energetic and enthusiastic. And sometimes people say like, too much energy at 7 a.m. Okay, just let's actually take a deep breath here because, it's a different culture. The breakfast is heavy, right? Breakfast is heavy. You go to the cafeteria with the residents and everything else. Breakfast is heavy here. The lunchtime, not so much, but the breakfast is heavy. So everybody's kind of starting the day in a different path. We fast and doing things, but we're not talking a lot. We're not doing much. It's kind of like, if you go to Brazil in the cafeteria in the morning, after you run and everything else, it is almost not a party, but it's like, hey, how are you? And everything else, everybody talking to 3 or 4 tables down the aisle. So it's like, it's quite different. So I think one of the biggest actually obstacles of being an IMG for me in the United States is to actually get into the culture and learn what is expected and how to succeed. Because depending how you play the cards, depending how you actually, how you mold yourself, not that you're gonna lose your characteristics. They don't want you to lose it, but you have to make sure that you actually be moderate and go into the culture in a way that you're going to be successful, and people are not going to say, I'm not going to write a letter of recommendation for this resident after he's been a prelim 1 year because he did everything that he's not supposed to do. So those are the things that are important to talk here, because most of the IMGs do not get a categorical spot. Most of the IMGs go into the preliminary route, and that preliminary route is something that you have to be very careful about.
Thank you so much, Dr. Rafael, for answering that question. I believe the cultural shock is something that a lot of the IMGs also face when they go for their electives. One of my friends was actually telling me how much of a cultural shock it was when he went for his electives. However, he mostly had positive things to say because I think somehow his energy really matched with the residents. I don't know. Thank you so much. Gabriel, would you like to go next?
Yeah, thank you, Dania. So I wanted to echo to the audience our little chat before the recording that we were talking about the cultural difference to in Brazil. And I remember when I was in Germany, I was with a Brazilian friend and he told me, I can tell this person is Brazilian. And I said to him, how do you know? So maybe I wanted to ask, what if you have found any cultural difference in interacting with patients, because we as physicians interact a lot and in our daily basis?
Yeah, so as I said, Dania, sometimes it really helps, okay? I think surgery is a little bit different than other specialties. And that's why we're talking here, right? I know that surgeons are just, super like dark people that don't talk. They're very like, mean people. Not that, but I think there is a different actually set of skills that somebody should have in terms of approaching the chief resident, approaching the attending, approaching even the interviews when you get interviews for surgery. I think it makes a difference, and knowing who is the crowd that's interviewing you and who is going to be working with you. To answer your question about patients, I was saying, Gabriel, it was that sometimes, or Gabriel, sometimes what we have is that our patients are very reserved. So you have to be very, careful sometimes when you're seeing a patient, because careful to respect what the patient wants you to do. So the same thing that we had in the CS, I really, going back a little bit, the OET for me is a setback. It's a huge setback. And that's why the ECGME is already actually talking. And I'm always in the ECGME meetings. Every year I participate in the ECGME meetings because I'm part of the GME here in the university, the graduate medical office, the education office here. But it was great because you have to knock the door, you have to say, excuse me, or good morning or something. You have to clean your hands. You know what I mean? You have to, it's a ritual, right? So, but in reality, the CS actually brought that ritual from our clinics to the CS in terms of to see how people would perform, right? So what do we expect from a patient that's from Brazil? It's different than I would expect from patients that are from the United States. Some of our patients, they don't want to talk too much. They just wanted to know that's going to be done. Some of our patients want to actually talk a lot. But most of Brazilian patients, if you come and actually you're very straightforward, very direct, and you talk for 5 minutes and leave the room, that might come across as like this person is rude because you didn't ask me about my family situation or how things are or the other things. So I think that it really actually it's different when the American patients are here that are not American, the patients in America, the patients in the United States, because I see a lot of patients that are not American. So you have to be a very versatile. And the two most actually common patients that I see that are not from the United States, for sure, it's Hispanic population here because I speak Spanish and I speak Portuguese. So for me, it's kind of easy to talk to them. But the second most common one in my clinic is Russian, and I do not speak Russian. So how I approach the patient. So this question is it's a misleading question. I'm sorry to say that, but it's a misleading question. When you say interact with patients in the United States, it's not interacting with American patients only. It's interacting with other patients. There are patients that are from other places, from Pakistan or from Brazil here and everything else. They bring the culture with them, and they expect you to. Sometimes they give you a hug. I have a patient that's Russian patient that's actually the son of the patient actually gave me 3 hugs when I was seeing them in the room. What did I do? I hug because that's what I know what to do. Because in Brazil we hug, you know what I mean? So for me it was a no-brainer, you know what I mean? So you have to wait. If they come and it's like I want to. There's an American. I have an American patient that say like, "Can I give you a hug?" So my Russian didn't ask. He just hug me, which is okay. I mean, I accept that. But some people here would say like, why are you doing that? Don't touch me. They don't touch me. There's the don't touch me actually mentality that you have to be very aware. Okay, it's not okay to touch people without their consent. It's not okay, and especially in the United States. It's not okay to volunteer that. Okay, so what is the difference is like, it's not okay to touch anybody without consent in Brazil either. Okay, but because of the cultural like flexibility, sometimes some people will come and actually give you a hug in Brazil, right, and you hug back. But in the United States, I think there is more of like a little bit more of like, you know, this difference in terms of cultural difference, and you have to understand and you have to respect if you want to come to this country. It's not something like, you know, I don't care, I am the way I am and I'm going to do whatever I want to do. That's when people fail. That's how I see my preliminary residents sometimes failing terribly, when they believe that they can do whatever they want to do and they do not respect the house, actually the house the house actually things. So rules, I should say. You know, it's like you playing a sport and it's not your home, it's not the home stadium. You know, you're the guest. That's how I see it. At the beginning, that's how I see it, until you get acclimated, until you actually understand the rules. So the difference is that, for instance, if I'm seeing a female patient in the room and I need to perform a portion of the physical exam that I believe it is a physical exam that needs a chaperone, which is actually somebody that will accompany that female patient. It's a female staff member, let's say a medical assistant or a physician assistant or a nurse or somebody, or even like, you know, a female resident or somebody that actually is the same gender. I should actually get the female representative in the room to be the chaperone. So in Brazil, the chaperone reality, when I see a patient, is not as exercise, I should say, because there is the consent. It's a little bit more like, you know, the physician has this more of a consent. Here, it's more of a rule that sometimes you have a chaperone. So there are differences. Again, you have to do what's right everywhere anywhere you are, right? In the United States, in Brazil, in Pakistan, you have to be respectful. You have to wait for patients to consent to you. But sometimes there are a little bit more of flexibility, I should say, cultural differences. That's one of the things.
Wow, thank you so much, Dr. Malgor. Personally, I've learned a lot. I have no, I knew there were some kind of cultural difference, but I think I take a new learning from it. Rafa, I pass it back to you.
Yeah, so thank you, Dr. Malgor. Now the next question is, have you ever been in a situation where you faced discrimination as a practicing surgeon? And if so, how did you handle that situation?
Yes, I mean, I'm not going to say several, but a few times I did have that. It's funny because I have my lanyard that's the American flag. See that? With all my badges. I have like 4 badges because I go to the VA, I go to the Children's Hospital. I mean, the campus is a big campus. So it is not a joke. I'm grateful to be where I am. Okay. And if you come to the United States, just, you know, and you start here and you say like, this country is messed up and, you know, this is not, you know, this place is completely like out of touch and everything else, you might consider not staying here. Because if you're going to stay here and you're going to complain all the time and you're going to be a miserable person, that might not be for you. You know what I mean? In life, you should be happy, not a miserable person, right? So the thing with the lanyard that everybody actually asked me, I used to have a green and a yellow and green one that used to say Brazil. But here, even in Colorado, which is a pretty actually now, so it's a swing state that we call for politics, and now it's a blue state because of the governor, which is our governor here, Jared Polis, is the first, I should say, I should say he's a very liberal governor here in the first ones, I should say, very liberal. And we have this liberal mentality here. But I went to a room and I had a very educated patient that day. And the patient, actually, I was in the emergency department. And I went to see the patient and I was talking to the patient. The first question the patient asked me is like, where are you from? And I have my lanyard and everything else. Like, I'm from Brazil. That's why I use this lanyard. I try to make conversation with the patient. The patient said like, so you're not from here. It's like, no, I'm not. And he said like, but, it said like, where did you go for school? I said like, if your question is about the medical school, I went to medical school in Brazil. I did my training in Brazil, but then I came to here. And believe it or not, sometimes it's not necessarily mandatory, but sometimes you'll say like, I went to Johns Hopkins or Mayo Clinic, I did research, this and that. It becomes a little bit of a reference. And sometimes the patients kind of know the place you're talking about. If you say like, I know I went to Fargo, North Dakota for the University of North Dakota, that's fine. But some people would say like, okay, it doesn't carry what we call here. I think it's it's not the best word, but what do we call pedigree that we call, right? That call that actually that you have something to look for. So I told the patient like, I did my research in the clinic, and then I redid my residency in New York at State University of New York at Stony Brook. I did my integrated residency there. But the patient like, I understand, but you're not from here. Please, he said like, if it would be great if you can leave the room. So my resident was with me there. My resident is from Indian descent, and he's from Brazil, first generation, from India, first generation from India here. His parents are foreigners. So I talked to the patient, and how do you handle this? The second part of the question is, how do you handle this? So the way you handle this, you don't say anything like, you don't know what you're doing. I'm the doc. No, the way you handle this is like, sir, I hear you. I understand your concerns, and I would like to excuse myself from the room. I'll leave now because that's your wish, your wishes. These are your wishes. So I'm going to excuse myself. I'm leaving the room now, and I will find somebody to take care of you if available. That is, as you request, as you wish, somebody that is educated in the United States and have all the education, was born in the land and the whole 9 yards. And the patient said like, good. And it was not even like, no, good. So I left the room. My resident apologized 4 times. And he said like, I'm so sorry, Dr. Malgor, this happened. Just like, why are you sorry? You didn't do anything. But my resident said like, I just feel terrible, because this should never happen. You know what I mean? Especially in this country that we have this freedom, and you know what I mean? This should never happen. And then I told my resident, I don't want to say his name, but, keeps coming to my mind. So like I told my resident, and I said like, it's, it's unfortunate this happens, but let's see if Dr. So-and-so, one of my partners actually that's from here, can see him. So it was not an emergency. If it was an emergency, that becomes a little bit trickier, because we have to potentially call risk management to see, because, if the patient really signs a consent saying like, I really don't want this, and there's nobody else to take care, we have to potentially transfer the patient or something. But the right thing to do, I've seen that when I practice this is in Colorado, but I practice in Oklahoma, which is considered a very conservative state. And but there's great people there too. I mean, it's not like, it's you see one state, it's like, oh my gosh, I'm not going to go to that state. But even in Oklahoma, I had patients coming to the front desk and saying like, who am I seeing today? Oh, Dr. Rafael Malgor. That's how they say my name, Rafael Malgor. How about Dr. Rafael Malgor? What's a weird name? And I heard that, what's your weird name? And I said like, okay. And I was just like, I was really in the room next door to the reception, and I could hear that. And it's like, what's a weird name? Where is he from? He's from Brazil. Find me another doctor. I don't want to see him. You know what I mean? Oh, we have Dr. So-and-so that's from here. Good, great. I'm not seeing this guy. And there was one patient that, I came and I introduced myself, and I basically in Oklahoma too, got out of the room. They examined me, said like, you have this accent, and I don't think my accent is very thick. You know what I mean? I can communicate very well. I believe a lot of people have told me that, but the patient couldn't tolerate that and said like, you have this accent, and for me, I don't like it. And he left. And I was literally sitting in front of the computer. He left the room. So how do you deal with that? You can report, you can do things, but we have something that's called risk management. If somebody becomes very belligerent against you or something, then you exit and don't engage. You excuse yourself, you leave the room, And then you call the hotline for a risk management and say like, I'm having an issue here. I need guidance. And then it's the legal actually part of the hospital that's gonna get in the game, and they're gonna send like mediators and what's happening, what happened. I don't want to see this. Okay, that's fine. But that's happens during daytime. You know, if it's in the middle of the night, like it was in the emergency department, you have to know how to handle it.
Thanks so much, Dr. Rafael, for your honesty. I think this could be like a very hard situation to be in, and thank you for your honest answer. So maybe you can go next, Gabriel.
Yeah, sure. One of the most important questions that international medical graduates have is regarding the qualities that make a candidate not only stand out in their application to be interviewed, but how to stand out also in the interview. Maybe you can elaborate in the do's and the don'ts for also the interview.
So Rafa actually sent me the interview, as in Matthias, her name, I forgot, yeah.
Isadora Matias.
Matias, is. Then he sent it to me, the interview, and I looked just to make sure that I wasn't that far off for my interview, I should say. So I saw she answered a similar question saying that you have to be yourself, right? I mean, she said like you have to be yourself, you have to, make sure that they understand you. I think being yourself is always important. Being mechanical, like, really like, you rehearse, but you can't engage in a conversation. It's never good. So I think the dues is to be yourself. I think it's okay. I think it's very nice. It's a good thing to be yourself, right? I think the dues is to know how to portray yourself. Like, you sit down, like, you just don't sit down, like, you put your just drop something, but you don't put your arm there in the chair and then say like, okay, I'm here today to interview. Okay, which questions do you have for me? And then the program director is going to look at you and say like, excuse me, I asked the question, not you asking me the question. So it's nice to be very like extrovert. It's nice to like, to engage in the conversation, but there's two things you have to understand too. Being an extrovert is a great thing, but if you actually answer your question for a surgery interview and you're not very focused and you keep on talking, and I'm talking a lot today, I am an extrovert, but I'm talking a lot too because I think we should share most of this information today, but you have to know that you have to be very focused. So the do is to be in the surgery interview is to be focused and to answer what they're asking you. What is the question? So when you ask, what are the advantages, the disadvantages, right? Or being a surgeon in the United States, what did I do? Okay, advantages. I start actually listing the advantages of being like here, like, growth rate and this and that. And then disadvantages, the culture shock, this and that, done. And then I stop talking. And then, Dania, why don't you ask the next question? Gabrielle, why don't you ask the next question? Rafa, back to you. You know what I mean? Because I stopped, because that's what, you have to answer the question. So do's, answer the question, be focused. Try not to talk extensive a lot. I mean, try to explain yourself, but do not speak for more than like 10 minutes because your interview is going to be 5 or 10 minutes. So if you answer one question, you're going to give your interviewer the opportunity to ask you one question if you answer in 10 minutes. And most of them, they're not going to interrupt you. They're going to let you talk. And if you go on a tangent and you're not answering the question, they're going to say like, oh my gosh, this person went in a tangent. Hard. You know what I mean? Not ideal. And then somebody's going to knock the door because that's what happens in the interviews here. Somebody comes in and knock the door, and then you say like, come on in. And then it's usually somebody like program coordinator or somebody from your office knocking the door. Dr. Malgor, Dr. So-and-so is ready for Dr. So-and-so. And then he's going to, I'm nice to meeting Dr. Malgor. Thanks so much. I'm sorry, I couldn't finish my thought. It's one question. And then Dr. Malgor is going to have to actually grade the interview, right? Based on one question. and I don't have the opportunity to answer 3 questions, because sometimes the third question is the question. Third question is the question you're going to shine. You know what I mean? The first question is where are you from, the whole 9 yards, or not where are you from, but how's your experience outside of the United States? You know, I saw you from Brazil. Tell me about your experience. And then you're going to talk, and you talk for 10 minutes. And then they cannot ask you about your best paper. They cannot ask you about your rotation at other hospital. You know, they cannot ask you about your previous experience. So you say like, I'm from Brazil, or my experience has been very positive. I've been it was very nice working in this community project in Brazil. And this, and you say, you know, that's basically it is. And I really enjoy my experience in Brazil has been good so far, but I wanted to amplify my experience by coming to the United States. And I think, because I think the United States can offer me a lot of other resources and everything else. So, and then you stop. And then they're going to ask you the second question. Okay, I like your answer about the experience and everything else. So tell me about your, you know, your best research experience now. And then, for my case, I was a research fellow at the Mayo Clinic. So then I just I plowed through, right? I mean, I went through. It's like I have 9 papers. I presented this in society, in this meeting society, and then I capitalized on myself, because that was my strongest at that point, to capitalize, right? So the dues is capitalize on your strongest. So if you're strong in community actually projects, and especially in this holistic interview that's now in surgery too, if you are strong on in the community projects, you went to me in the middle of for Brazilians, like in the middle of the Amazon, and I served the 1 year in the army or something, or do something else. So this is the do. Focus on your strongest. Okay. If you have 0 research and somebody or minimal research, and somebody actually asks about research, you answer the question, you focus, but don't keep on saying like, I wish I had more opportunities. You know, if I had more opportunities, I could have been much, and I'm so sorry. I'm so sorry, Dr. So-and-so, Dr. Malgor, I'm so sorry to say that, but you know, don't feel sorry for yourself. Okay. There is a saying in the United States that says, don't feel sorry for yourself. Don't feel like the victim. You're not the victim. Don't feel like the victim. If you get to the interviews, you're as good as anybody else. Okay. And I have seen people with lower scores beat actually people 10, 15 points more, because the interview was a blast. That interview was amazing. Put that person actually from the lowest actually to have very high in the list. In a sense, here, I talk with my hands. Nowadays, I think I can, because I'm on a thing, but anyways, but anyway, so when you get you there, you know what I mean? You can get you a point in the list that if the list rotates or goes down, might get you, and you get matched. You match. You know what I mean? So the interview is very important. So the dues is to be yourself, to be focused, to answer the question, to capitalize, and to be, you know, to capitalize on what you did. In my case, when they asked me about my experience, I said, I have been training in Brazil, because they are always nervous. Everybody's nervous about old grads. You know, I can do another interview just on old grads, you know. And we just accepted somebody that's an old grad in our program. So the thing is that you have to capitalize. So if I had training in Brazil, you have to know how to sell it. You know, I had training in Brazil, but I said like there's several other things that I haven't learned. So that's why I'm here. Endovascular, thoracic aorta or something that I would like to learn from here. And so how do I see my training in Brazil was good, but it was incomplete. So please enlighten, please illuminate my path. That's how, you know, I mean, you don't say that, but you make them believe that you not have that attitude saying, I just want to come to the United States because of more money, less violence or something. You have to make the program understand that you're there because you want to be educated. You know what I mean? Otherwise, why would somebody take an old grad, you know? And please do not sit on the chair like this. Don't do things like, you know, maybe don't talk to your hands, maybe have some posture, maybe actually be more like presentable during the interview. Everybody kind of has a dress code. The places have dress codes, you know. Some places don't care much as about, like, you know, a student tie for male, or a different attire for females. You know, some people are more, but I can tell you, at the Mayo Clinic, I work with a student tie every single day doing research, because that's the Mayo way, they call, right? Because that's the culture there. So you gotta know, you gotta understand the culture where you interview at.
Well, thank you so much, Dr. Malgor, for clarifying all these knowledge. Dania, why don't you go next, please?
Yeah. Last but not the least, Dr. Rafael, we have a question for you, which is, we basically would like you to give any IMGs like myself who want to pursue surgery in the US any advice.
The advice that you know, if you have a dream, you have to pursue your dream. I mean, some people would say, like, you know, it's easy for you to say that because you succeed, you know, you're a successful story. And it's always like this, right? You look at the you go to those, you know, social media, you know, USMLEs, actually, the groups that we have and everything else. What happens? I applaud, and sometimes I even comment on some people that actually report actually bad scores, or are not ideal applications. Why is that? Or I could never match, or I matched like after 3 interviews in a small place. Why is that? Because what you see sometimes in the social media, it's only the winners, right? You only see the people that actually have a different story to tell, right? They are huge scores and everything else. And I'm associated with, like, you know, mentees that have stratospheric scores, and I'm associated with mentees that don't have those scores. I think everybody has their place. Okay, maybe the best scores are going to go to the most prestigious places, but the other not so good scores will get actually a position here. And here for us, sometimes, you know, if you're a good surgeon, somebody gives you the opportunity to train, you're gonna excel no matter where you are. I mean, you can be in a smaller program. Sometimes the problem is, like, you know, I'm today in the University of Colorado, and I'm actually integrated program as an old grad when the competition was ridiculously high. There was only 15 programs for, like, you know, there was like 8 or 9 per spot or something. It was really high. Competition was very hard. And I capitalized on what I knew, which was a little bit of my previous training and my research. Other people capitalized on their USMLE scores. Even though I was a 99 percentile for my Gaussian curve, because if you say, like, oh, everybody's actually not everybody, a lot of people getting like 160, 170s, 150, whatever. In reality, if nobody can get you 150 and you still 99 percentile, that means that that exam was probably very hard and nobody could actually get you. Some people would be at 170 for the 99, the first percentile, right? But the majority of people will be in that range. So people that you're testing, that range. So without scores, that open actually something, right? What would I tell? Focus actually on the scores, focus on the exams as well, and everything else. Don't let it actually discourage you if you don't have the best score. Okay, you just have to do something different. You have to you have to think out the box and actually do something different. How I'm going to sell my skills, or how I'm going to sell myself in terms of the interview, you know? So if you have a plan, you know, you said, like, oh, people said just apply for internal medicine because it's easier. You just have to understand that, you know, internal medicine is not your cup of tea. You're going to have to actually deal with that for your entire life, for 20 or 30 years. It's going to be that misery that you're going to wake up in the morning every day and you're going to say, why did I do this to myself? I don't like my life. Sometimes you can find something that you like in internal medicine. You become a GI doctor because I like procedures. You become a cardiologist because I like stents. You know, that's okay. I mean, I think people reinvent themselves. The problem is that I see is like not giving yourself a shot from the first time. If, however, if your, let's say, the combination, your application is something that cannot be changed, then you have to think back. That's the only exception to the rule. The only exception to the rule is you look and say like, okay, I failed step 1 3 times, I failed step 2 4 times, and I finish everything. I have ECFMG certificate, but I have too many red flags. Then I can tell you, being realistic, it's something important. Put your feet on the ground. And I say like, you know, if there is a lottery, I won the lottery, I'm probably going to be actually able to match in surgery. And I have seen things, weird things like here that you see like how in the world this person is a resident in this huge institution with this type of package. Sometimes what happens is that the person's just like there doing research or an observership or something, or a clerkship, or not clerkship, but an observership or something. And the resident actually, or, you know, gave up like 2 months in, you know, and the other person has the application complete, but the application is not the best, but that person is the best. It's a nice person, knows how to do things. And that person is at the right time, the right moment, in the right place. Okay. So it happens here, but you cannot put all your hopes on the zebra, on like on the random stuff. You know, you have to prepare yourself. So you have to have like preparation to meet the opportunity, right? So then you're successful. So study hard for your exams, score as high as you can. If you already scored, that's fine. Look at the possibilities. If your score is an okay score for that specialty, you don't need to have like 270, okay? Just because say like, I need that to go to surgery. No, I've seen people actually matching with 245 in integrated programs. Granted, that person had 35 publications and like Lancet, circulation, perfect English, and the whole 9 yards. So it's a combination. I know I'm talking a lot. So the last thing I want to tell you, whenever you see something in social media, in Facebook groups and everything else, try to see if that person has a differential. Okay. Sometimes you see people like there have never been a Brazilian at Johns Hopkins, let's say, in surgery. Let's say something like that. Okay. And then all of a sudden you see that, somebody matched there, and you know that Johns Hopkins doesn't sponsor visas for categoricals. And then you see that that particular person, even though it's from Brazil, has a green card or something, or a citizenship or something that helped actually break that barrier. Does it make sense? So whenever you see somebody that's stratospheric or very good, you have to put into perspective that sometimes there's something that you're not seeing there. Something that's not seen there. For example, doing research 3 years in a row at the Mayo Clinic, okay? And then puts like, the score is not very good and everything else, and you say like, how in the world this person actually matched in this very competitive residency? And then you go back, oh, that was the research fellow that stayed at Mayo for 3 years and pulled, I don't know how many dozens of papers. Does it make sense? So don't think that just looking at saying like, wow, this is amazing, this person, it is a combination. Sometimes you see very successful people that you say like, how in the world this person got to where the person is only with scores, and other people with the same scores interviewing well could not get there. Sometimes there's something there. Sometimes there's 35 publications. Sometimes there's a green card that doesn't need visa sponsorship. Sometimes there are other things, or a good interview. So it is a combination of factors. Somebody actually asked about like work-life balance and how to manage that. So in the US, I think you can tailor work-life balance, right? You can work solo. You can work like with 2 surgeons and be on call every other night or every other day of the year. It's up to you. I mean, if somebody wants to do that, you know, you can pick and choose. But there are other actually big groups that actually have a better actually call schedule. So in the end, I think work-life balance is something that you can look into, like, I pick and choose what I want. Okay. So work-life balance is, for a surgeon in the United States, I think it's pretty good, especially when you have like 3 or 4 people in the group. for a surgeon, okay? You might actually be on call like a week at a time, but then you're not on call for 3 weeks in a row. So for me, that's work-life balance. I think the best thing to do with work-life balance in the United States is this country is huge. It's huge in terms of territory, right? So let's say you like to go, I don't know, ice fishing. You can take a flight from here to Alaska and actually ice fishing. By the way, you don't need passport, right? Because, if you like, in the United States territory, even if you're a J1, you don't need passport. I mean, maybe you want something more tropical, or like you want to eat some Brazilian food, right? Or you want to eat some great Cuban food in Miami, right? So you just get your flight, go to Miami. You know what I mean? You go to the beach if that's what you want to do. Or if you want to do something different, you can say like, I want to go to Denver to ski in Aspen, Vail, or other place, right? So you come here where I live, in 2 hours away, an hour away, you go there. One of the best places to ski in the world. So you're here, right? I want to do something different. I want to, a big river. I'm a river person. You're going to do fishing or something in the river, or rafting, boating. I'll go to Idaho. I go to Mississippi. So work-life balance, you create it. You create a work-life balance. If you want to work out all the time and not going anywhere, to the beach, to the mountains, to fishing, or if you don't want to be outdoor or hiking, that's up to you, my friend. I mean, work-life balance, you pick and choose. Nobody's forcing you to work in a practice that you're on call 365 days a year. You have to do that yourself. You have to choose yourself. That's how I see it.
Thank you so much, Dr. Rafael, for your time and for having this extremely and immensely informative session with us. I'm just so grateful to you, and I'm sure everyone else had so much to learn from this. What I have gotten from everything that you just told us is, at the end of the day, I think you have to trust yourself and your efforts. You have to stay passionate, stay hardworking, and I do hope I am as positive a person as you, because I think that's what you need, especially when you have to want to match in such a competitive field. And I think you also have to really try to learn about yourself, have an insight about what do you want, and that's at the end, I think that is how you will be yourself, not only for the interviews, but also to progress as a person and in your profession. Thank you so much. And I think we will end this session now, and I hope you can, we're not making you late for your next interview. Thank you everyone for joining today with us. Just really extremely grateful to everyone. Thank you, Rafa. Thank you, Gabriel. Thank you, Dr. Rafael. Thank you to the CP Solvers team for giving me this opportunity to have this session for surgical people who want to pursue surgery.
My pleasure. And I'm available. I am actually in that group. The Brazilian, for the Brazilians here. I'm the USME Brazil. Before I go, I look in the chat. I usually look. There's one last question, and then I go. There was last question about actually grades in the medical school in Brazil, or in any other place, right? Less so, I should say, the GPA and the whole 9 yards here. Of course, if you don't have, an MSP or something, sometimes MSPs are not, it's more like, the candidate talking and say like, this is an MSP, and educating the university to know what an MSP is, right? So aside from that, and, we do look sometimes, but let's say you didn't have good grades and doing medical school, and medical grades are like B minus or something. But then you go there and your USMLE score is like through the roof, right? Super high. And then you say like, what do you think they're gonna consider? The B minus or the C plus, or you barely passed? Or they're going to consider your USMLE scores that are actually through the roof, or your research, or your community experience and everything else. So I see the MSP playing a role much more for people from the United States. There's several other pitfalls that we didn't talk about. And the last one I have to say is that I keep saying holistic review. Holistic review. Go to the AAMC, the AAMC website, and type it in holistic review. Okay. I believe the holistic review might be the future. Okay. That's a huge actually hint that I am giving here. For everybody here in the internet, but the holistic review at AAMC, we are focused not only on scores. If you make that cutoff, you're gonna potentially get an interview based on the holistic review. So if the cutoff is 230, let's say there's somebody that's 260 and there's somebody that's 245, the 245 might get the interview and the 260 might not get. And important to say, the spots for interviews in big places are very limited. We don't interview like 600 people. We interview 120 for 12 spots. Okay, so you have to make to that 120, even though you're the 600 on the cutoff with the score. Between the 600 and 120, there's a difference. You have to make actually that cutoff. So that's very important. And look at holistic review. Keep on doing community actually projects. That's another big hint. A lot of community projects, a lot of volunteering, a lot of volunteering to help communities, a lot of volunteering sometimes are doing research. The other things in the ERAS application, when you apply, there's several pieces, right? The volunteer work and presentations and everything else. Look at the scores, but if your score is decent and you're above it, focus on the other ones. And if you're already done with your scores, like everything else, start thinking about the other categories to actually plug on the volunteer work categories and everything else, because that's what's actually holistic review is about. It's about the whole, not only the scores, the whole, okay?
Thank you so much, Dr. Rafael. Again, the holistic, this was, you're right, this is a really informative hint, and I'm sure this session has given everyone a lot of hope, especially has given me a lot of hope. Thank you everyone for joining in. Dr. Rafael, again, thank you so much. I am going to end the session now. If no one has any questions, and Dr. Rafael, if you would like to say anything at the end.
I am just fortunate. Anybody?
All right. Thank you so much, everyone. I'm definitely, it's 12:47 a.m. in Pakistan at the moment, so I might be going to sleep after this, but everyone have a great day. Have a nice day. I wish you all best of luck for anyone who's applying as well. And I wish you best of luck for your meeting, Dr. Rafael. Thank you so much.
Thank you.
Thank you, Doctor.
Thank you. Bye.